We are live, I think. I tried to start a live maybe like 2 minutes ago and it grayed out and I could not see any comments and I could not see anything. So, but now I can see myself talking and we will hopefully have some people joining us here. We are doing a live this evening, brief one, maybe not too terribly long, on forensics. So let's see. Cheryl says hi or hello from California. April Hess is here, and Emily Farrell or Farrell. Jennifer, hello to you. And Melissa MT in Ireland. Erica's here, so that's good. And hello from Wisconsin, future. Hey, I know you. I've seen your name in my email. So hopefully future forensic pathologist. Cheryl's daughter is an autopsy tech, that's great. That's great. I'm sure she has seen a lot of different things. Sarah Jones is here from WA, which I'm assuming is Washington State. Patty in Moorhead. Deanna in Phoenix, and yes, I know you too. I know a lot of people that's on here. Oh, great. Applying to forensic pathology programs this year. We need more. That's all I got to say is we need more. It's one of the things I preach on is more forensics, more forensics. Let's go back here and see what I missed. Cypress, Texas. Yep, I've seen, we've got some regulars here in my live, which is kind of cool. I like that we have kind of a regular group of people that's coming in, and hopefully we'll get even more. Patty says, thank you for the answer about the AAA abdominal aortic aneurysm. Ken Music says, hi doc. Hello, Ken. Abdominal aortic aneurysm is something you definitely have to watch. Certainly blood pressure, that sort of thing. They're probably going to follow it with ultrasound or CT scan to make sure it's not getting too big. Usually 5 centimeters or more, they start to talk about doing surgery. It is something I see in my job. So, you got to be careful with those. And flapigator, I guess that's what your name is. Yeah, I'm on. This last couple of weeks I have not been on very much here, and I'm in this white room. It's almost like I'm locked up. I'm psychotic and I'm locked up. But this is a room that I am remodeling in my house, and this is probably going to be my future studio. Let's see. Drug overdose. 20-year-old daughter passed. Chloe's here. Chloe, possibly, I think you said you were maybe thinking about doing forensics. Is that right? I have so many people, but yeah, I mean, that's great. I hope whatever you do, it's going to be going that direction. But yeah, I read the comment about the drug overdose. As I've said, we are seeing so much of the drug overdoses right now. It is staggering, and it is sad because it is something that can be preventable, and a lot of the things that we're seeing are pills. So people are getting pills from whoever. They think it's a pill that's got this compound in it. I think I'm taking a Valium, and then it turns out it's a fentanyl or something like that. So, that's a huge problem that we're seeing now. And it's in my area, in sort of like central Indiana, they're blue pills. They're actually little blue pills. They're not Viagra, though. They're containing fentanyl. And so now Chloe confirms that, yes, she is interested in going into forensics and that she is trying to get a biology degree. That's a good degree to do for forensics. I was a microbiology major, but I have to tell you, I was not interested at the time that I was in college of going into forensics. That was something that would not have even been on my radar. So yeah, biology is good. Micro is good. The reason why micro is good for me is that medical school is heavily there's a lot of testing on microbiology. Microbiology is one of the most testable subjects in all of medical school. So my advice to you would be, you are majoring in biology, but if you have the time in your schedule, try to knock out some microbiology classes. I was fortunate in that my university that I went to, which is Indiana University in Bloomington, they had a class called medical microbiology. So I was able to take a full semester class on medical microbiology, and I had a great background going into medical school for medical microbiology, and it was great. I really enjoyed it, and you can't have too much of it because there's always somebody who knows more when it comes to microbiology. But I'm pretty good. I can talk shop on it, with most people. All right, what else we got here? What other questions do we have? I don't have a lecture prepared. I was at TikTok before, and we talked about left anterior descending artery blockages causing heart attack. We talked about abdominal aortic aneurysms and kind of like, what are those like? We talked about what does a heart attack look like physically with the heart. We talked about meningiomas, so brain tumors or tumors of the lining of the brain. Daughter has cell and molecular biology with biotech masters, brains for pathology, but not the stomach. Well, the stomach is, that's one of those things that it is something I think you can get used to over time. But there are some people who are just extra sensitive to it. I just told my daughter to get in here, so I hope she will join. Well, of course, if she does, that would be great. I'm probably going to be on, I'm guessing, until around 9 p.m. Eastern time. So that would be about 23 more minutes. LH says, how much of the patient's background, such as medical records and paramedic records, factor into the autopsy? So I cannot speak for every pathologist, but I try to get as much of that information as I can. Okay, so it sometimes is helpful and sometimes it is not helpful. But I request EMS records, I request medical records on any case where I have a single question, okay? So, yeah, it factors in, believe me. Let's go back here. Jen says, I'm an autopsy tech, and you must be the daughter of what is it, Cheryl, I think, that said you should come in here. How's it going? Well, it's going pretty good. I have had the busiest month of my career in March, so I guess you could say that I'm a little tired. So Chloe is in Michigan and hope to stay in the Midwest. Well, there are plenty of jobs around if you want to finish up and move south to Indiana. Is gallbladder pancreatitis dangerous? So what you are saying is, I'm thinking, is pancreatitis due to gallstones dangerous? I think that's what you're asking. And the answer is it can be, because any pancreatitis can be dangerous. The idea behind gallstones causing pancreatitis is that, of course, you have these little stones, they get lodged in the common bile duct, or they get lodged in the pancreatic duct there. The pancreatic juices back up and they cause acute severe pancreatitis. The worst case scenario is that it goes toward necrotizing pancreatitis. Necrotizing pancreatitis can cause death. But if you catch it early enough, you can go in, ERCP can pull the stone out, or if you can even have pancreatic surgery, which is not a surgery to take lightly. But yeah, any kind of pancreatitis can be dangerous if it proceeds toward necrotizing pancreatitis. You can get necrotizing pancreatitis from alcohol use. It doesn't have to be from gallstones. Now let me scroll back. Let's see. I'm going to have to figure out how to pronounce your name, Doctor. From my poor pronunciation of what I guess is a Korean name, maybe Gwen Young. Maybe that's how I pronounce it, but you can correct me on that, and I apologize if I got it wrong. So how is my life as an independent forensic pathologist? How many days do I work? Pros and cons of independent practice. So I work in an area that doesn't have very many forensic pathologists, so I work more probably than I should. However, my autopsy work is condensed on about 3 days of the week. So I will autopsy on an easy week, I'll only autopsy 1 or 2 days, and on a bad week, I'll autopsy 4 or 5 days. But on average, it's about 2 to 3 days a week, with the off days being looking at slides, reviewing medical records, talking to lawyers, doing depositions and things like that. So it's pretty good. I would say that, sorry, let me scroll back here. Sorry about that. Life is pretty good. I would say that, it's busy, but it's as busy as I want it to be. I mean, if I really wanted to quit, I could. But, I don't really want to do that just yet. So I would say if you are an independent contractor, you will never run out of work. My friends vary from people who work at medical examiner offices to those who are independent contractors. The independent contractors tend to work less days per week, but you can be as busy as you want. So and I apologize for getting so behind on questions here. So Jen DePsycho, yes, we are very happy to have her here. Have I seen hospice patients with glioblastoma? Are you seeing an upswing in this diagnosis and autopsies? So I am not seeing an upswing in glioblastoma in my area, so I would say no. Can you be an organ donor if you're getting an autopsy? Yes. In fact, I have probably an average of 1 case per week of somebody who was autopsied who donated organs. In fact, when I go back to work next week, I do work like 1 day next week. That person I know has already been procured for organs that I'm going to be doing an autopsy on them. So do I have my own office or autopsy suite, or do I use the hospitals? So I travel to standalone morgues. 75% of those morgues are in hospitals, and 25% of those morgues are just in the community, like a standalone morgue. Yeah, so control over your life. Here's what I would say to you, young doctor. I would say, if you want to be an independent forensic pathologist, you will make plenty of money. But I would say figure out how much you want to do, and do not commit to more than that. Because that's my problem, is I commit to more probably than I should, and I still turn down cases every week. I turn down cases, and I turn down legal consults. I would say if I were in your position, and in some ways I am in your position, I just have to arrange things differently. I would say, ask yourself, how many autopsies do I want to do this year? Answer that question, and then how many legal cases do I want to do? And then figure out how much you want to charge and stuff like that. Okay, let's go back. Do I ever lecture publicly where you might attend? Well, I live in Indiana, and I tend to lecture in Indiana when I do lecture publicly. So that would be I used to lecture more in the public before the pandemic, but when the pandemic happened, I don't really like to be in crowds too much, and I don't think they're doing as many public lectures as they used to, although it's probably starting back up this year. I used to lecture a lot in public in Indianapolis, and and sometimes public health type stuff. But in the future, I might. And what I will do is, if I am lecturing publicly, I will probably make an announcement here on YouTube or on TikTok. Now let's scroll back here. Um, let's see, private autopsies at funeral homes. Yeah, so some of the cases I do are similar to that, although usually I have them transport the body to a morgue where I am already. So question is, how do I deal with complex cases? For example, if I need support from a neuropathologist. So it's very simple. If I really feel like I need that, I reach out to the medical center, or I reach out to whatever expert that I need. And I basically say, hey, listen, I've got this case. I think it's beyond my abilities to diagnose. Now, of course, that doesn't happen very often, but if it does, you reach out. And what I do is, if it's a private case for a family, I let them know ahead of time, hey, listen, I think this could be difficult. I'm going to have to charge extra because I'm going to have to pay a neuropathologist on this case. Or I'll have them pay up front X dollars, and I'll tell them, if we have to get a neuropathologist involved, you will have to pay that price. So getting a neuropathology expert, pediatric pathology expert, ordering immunohistochemistry and stuff like that, it's not that big of a deal. You just have to establish connections and then, send it out. How long does it take a full autopsy from first incision to closing the body? So it depends on the case, of course. I mean, if it's a 200 gunshot wound case, it's going to take two days. But if we're talking about standard person found in hotel room with needle in arm, man mowing lawn who falls over dead, my assistant and I, we work at the same time. I start the chest, she'll start the head, and we'll go through it. I mean, we could be done in 35 minutes, start to finish. But I usually talk and teach during my cases if I have people come to my cases. And as a result, we average about an hour, because I'll have a police officer, I'll have a prosecutor, I'll have a medical student. And so I'll show them what I'm doing, and I'll say, hey, look at this. Let me show you exactly what's happening here. Let me tell you the pathophysiology behind it. But if it's just me and my assistant and we're alone and there's no teaching, we can get a body start to finish in probably 30 to 35 minutes. So would I consider online lectures? Yes, somebody actually, I believe it was Chloe in this live, asked about doing online lectures. Now, if I do like a fancy online lecture where I actually teach a true lecture about like gunshot wounds or something like that, and it's an hour long, I mean, I'll probably have to charge for that, because that's like a lot of prep, to go through that and build a lecture and make it good and make sure the sound and everything is good. So yeah, I mean, I might do something like that, but I guess you could consider these mini lectures. Yeah, I do teach while I work. I like doing it because it keeps me fresh. Pathology is I would go so far as to say it's the broadest field in medicine. Whereas everyone else is subspecializing, we are, pathologists have to kind of know everything about diseases, and then you add on trauma, and then you add on surgical stuff. So we don't do surgery, but we have to know about all the surgeries so that when we get post-surgical patients, we have to be able to interpret that. So I would say that by teaching it, it keeps me fresh and remembering how to go through those things. And then Flap says, viewers might be limited tonight because of March Madness. Yeah, actually, you know what's funny? When I started this live, I thought to myself, oh my God, basketball's on. I love basketball. And so I normally watch the games, and I felt bad starting the live and then stopping it 5 minutes later because I wanted to go watch basketball. So I decided to go ahead and just finish it. I'll just go ahead through the live and see what happens. But yeah, let me scroll back here. Did I hear in a previous TikTok that I offer a coroner's course online? No. So what happens is I teach it. This last one, I taught it live online. So it was like a 4-hour lecture, and it was closed just to the folks in the coroner system. Although I mean, I am considering doing lectures that would be, I mean, I'm sorry, but they're going to have to be paid. I know that that's not ideal, but I'm going to do more general stuff like that if I can ever decrease my autopsy burden. I have so many autopsies that I have to do. It's hard for me to do a lot of extracurricular. But if I could, I'd cut my autopsies in half and do the rest of it as lectures. So stay tuned for that. Maybe that'll happen. I work for a lab that processes brain tissues for Bennett Omalu. Have you ever come across a case that involved the brain condition that he discovered? Actually, yes, I have. In fact, I was just going through some of my photos earlier, pathology photos that I have, and I found a great case that was definitely qualifies for CTE. It's such a tremendous case, and I want to post it online, but the problem is TikTok, they tend to take my videos down if I show anything that's somewhat gruesome. And for CTE, you have to show the brain because you have to show the old contusions. So Melissa is watching the games and listening. That's a good thing to do. And your son goes to UConn, so he's probably very excited because UConn is in the Final Four and really probably the favorite to win it at this point. I am surprised by how good UConn was this year in the tournament. I had them losing much earlier in my bracket. Susan says your granddaughter wants to go into the field. Well, she can watch my videos and maybe learn a little bit. That'd be good. Flap says San Diego State beat Florida Atlantic by 1 point. Now, I got a text from my dad who loves to watch basketball, and I actually knew that because while I was doing the live, I saw his text come up. So I got the report from my dad. Now, I'm a little sad about that. I don't have anything against San Diego State, but Florida Atlantic is coached by a guy that went to Indiana University at the same time I did. And he went to a high school called Eastern Green, which is not real far from where I grew up in southern Indiana. So I'm going to check out the final play on that here in a little bit. Duty Ron says, good to see you. Duty Ron, unfortunately, I am getting off in about 7 or 8 minutes, so I won't be on here much longer, but I am trying to come over a little bit more. Can I post the CTE on YouTube? Yeah. Well, what I can do is I can probably post brain photos and then talk about the pathology. But what I've noticed is lately when I post something somewhat gruesome on YouTube, they will give me what is the equivalent of a community guidelines violation. And it's unpredictable and it's strange because other people don't get these and they show like full autopsies and stuff. The problem is if I get too many violations on my account, I cannot monetize the channel. And the channel, I would prefer for it to be monetized. So that way, when I do put up videos and do lectures and lives, I actually do get some kind of payment for that because I don't have infinite free time. I wish I did have more free time. That's why I have to do these in the evening. But yeah, I'm very, very close to monetization on YouTube. So I'm trying to play it very cool and not get any strikes against my account. Because as soon as I get monetized, I think it probably starts over and I might have a little bit more leeway with my account. Looks like Vincennes is the college that offers a degree to be a mortician. Any thoughts? Well, I don't know about mortician stuff. Like, I'm not very up on the mortician side of things. That does make sense that Vincennes Junior College would have, or Vincennes University or whatever it's called now, would have that. I know there's one in Cincinnati, but I don't know how many mortician schools there are in this area. But I'm sure Vincennes is probably the place for that. But I don't have any opinion on it because I don't really know what the programs are like. Yeah, Cheryl says, I've seen full autopsies on YouTube. Somebody told me that they see full autopsies on here, even of, unfortunately, like children and stuff. And that stuff exists. And I put up a video not long ago that had, I'm wanting to say it was the slice of a heart with showing a heart attack. And they gave me a warning for that. And the odd thing is, the warning was like for violence or something like that. And here I am trying to teach, medicine, because pathology is medicine. 100 years ago, all doctors were doing their own autopsies. Pathology is medicine. Medicine is pathology. And so I am teaching actual medicine. And I got dinged for it. So it said in the thing, it said, do you want to appeal this? And I thought, absolutely, I'm going to appeal this. So I appeal it, and I write a very cogent, pretty strong response to, listen, I am just teaching. I am a medical doctor. I am board certified, blah, 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 blah. And, they got back to me in 5 minutes and basically said, screw you. We don't care who you are. So YouTube, they have their favorites. If I was Mr. Beast or something, they wouldn't be doing anything. Mr. Beast could chop somebody's head off on YouTube with a samurai sword, and they would be fine with it. So Ron, I will take your advice. I will go back and I will look at the account and see if there's something I can do to because I do have a disclaimer in the account description, and I wrote it a long time ago, but I will double check that. And then Sarah says, what about Patreon? So I actually started a Patreon account back in January. Okay, let me rephrase that. I did not start it. I started the creation of the account, and it's about halfway done, but I just have not gotten around to finishing that Patreon account. It would be nice to do that, just simply because, when you look at my podcast, I have people every week say, please put up more podcasts, please put up more podcasts. And it's hard for me to put up podcasts which take a lot of time to set up, record, make sure the sound levels are good, edit the music, edit the sound levels, fade in, fade out, change the format, upload, do the whole thing, and actually get paid $0 to do that. I have made no money on the podcast since June 2020. So it's hard for me to put in hours and hours of my life for something that is just going to get listened to by 1,000 people, and there's no, compensation. So, but for now, I might consider the Patreon. The thing about YouTube is the monetization, when they actually pay you, is better than most other places. So if I can hang on and get monetized, it could be better. Take on Stephen Smith exhumation, second autopsy after 8 years. So I am going to talk about that. One of the videos I'm going to make is how an exhumation is done. But I was kind of curious to see what the preliminary on that autopsy would be after the exhumation. Also, I wouldn't mind seeing the original autopsy report. Wants to go into forensics. I would say that is definitely, we need more. We need 1,000 more. We have 500 and we need 1,500. So what would a body look like after 8 years? If the body is well embalmed, the body will look very good. The longest one I've ever done exhumed was probably, I think it was 3 years. And, I have to say, this decedent looked fantastic. She didn't have, I mean, she looked like the funeral was a week ago. So after 8 years, if the embalming was done really well, his body will look good. The body doesn't decay rapidly. One time I said the body doesn't decay, and I didn't add that last little adverb. And so somebody was very quick to point out, they were like, "Doctor, you don't know what you're talking about. People can decay with embalming." And that's the funny thing. When you're a doctor and you talk online, people, they live their whole day to try to say that you got something wrong. And it makes them feel good about themselves. But yes, the body will be intact, and I don't think that it'll look that different. The second autopsy will be very interesting though, because we will know whether or not the first autopsy was a good autopsy or not. Yeah, if you want, you can send me the autopsy report. I'll make a video on it. Yep, I recommended, sorry, my hand's in the way, Judy's book, and you loved it. That's fantastic. Judy's a friend of mine. She is a very good pathologist. She's one of the few people I trust. I really implicitly trust everything she says on pathology. Really good instincts. Alicia says, aren't caskets usually waterlogged? So that's a very good point, Alicia, but not always. If the casket or the coffin is really sealed and it's watertight, there won't actually be any water in the coffin, and the body won't be waterlogged. I've done exhumations before, one in which there was water leakage into the casket, and the person was just a giant block of soap. It was like cutting a block of soap. And then I had one where there was no water leakage, and she looked fantastic. So. What else? We'll do a couple more because I am at 9:02 and I was going to go to 9, but we'll just do a couple more little questions if anybody has it, because you can hear my voice is going out a little bit because I've been talking for an hour and a half, and that means I need to go get something to drink or maybe a snack or something. I will tell Judy, Debbie, she is such a nice lady. And you know what she always says when somebody says they like her book? She says, please go to Amazon and rate it, because it helps her and her husband who wrote it if they get good ratings. So I would say to you, as a friend of hers, go over and rate that book on Amazon 5 stars or whatever you want to rate it, and give her a nice little comment, because we like to support each other. And we like for forensics to get a bigger piece of the pie. Like if you go to TikTok or one of these, dermatologists are on there. Every dermatologist gets verified, 20 million viewers, and they're squeezing cysts all day. We're actually trying to help public health by having more people doing autopsies. Any other tips for undergrad years? Well, I would say, you want to try to max out your GPA, but you don't need a 4.0. Try not to slip up too much. I have seen people, though, who did poorly, who kind of started over and reapplied and went and did fine. So don't freak out about GPA. You don't need a 4.0. You really do need to try to keep it around 3.5 if you could. But if it's below that, you're still okay. One thing that helped me a lot was I had in my science classes, I did not have a 4.0, but in my science classes, I basically had a 4.0. It may have been like a 3.9 or something. So I took tons of science classes. So when I applied to medical school, I pointed out to them that my science GPA was 3.99 or whatever it was. And so, yeah, I may have taken a social anthropology class and gotten a B plus, but it doesn't really matter compared to my scientific knowledge. So, don't freak out about GPA. Number two, I would say start studying for the MCAT anytime. You could start if you're a freshman or if you're a junior, it doesn't matter. I would say start, because the longer you study for it, I think the more comfortable you'll feel. And you want to go into that test feeling comfortable. You don't want to go into that test by the seat of your pants where you've studied for a month. So I would say start studying for your MCAT, but don't freak out. Don't throw away your weekends. Don't throw away every evening of your life studying. Enjoy yourself. And that's one of the most important things, is enjoy yourself now, now that you have time. Because when you get further into your career and you become a professional and it somewhat consumes you, you want to be able to not have any regrets. And so with that, I think that I will be getting off of here. Chelsea says she's from Orange County, California. Well, guess what? I'm from Orange County, Indiana. I work as a coroner investigator and always show your TikToks to my cohort. They always something to learn. Well, that's good. I'm glad to hear that. I know that my TikToks are watched by a lot of people, particularly in the death investigation field. There are even some teachers who teach forensics in like high school classes who use my TikToks as like teaching points, which I think is a little interesting. It's kind of interesting to think that there are kids out there watching my videos during class. That's why I have to watch what I say. But yeah, thanks for your support. And thanks again. And I'm going to go ahead and wrap this up because there's probably some basketball to watch. I got to get a drink and, just going to have a good evening. So I'll talk to you guys next time.